Hello, good people. This is Dr. Stephen Okoro, your physician and health coach. Today we are continuing with our series on peptic ulcer. And the topic for today is, how is peptic ulcer treated? So if you are joining us for the first time, I advise you to seek out our previous videos where we talked about what a peptic ulcer is, what are the symptoms of peptic ulcer, how is it diagnosed, and if somebody has symptoms of peptic ulcer and then he goes to see his doctor, his or her doctor, and the diagnosis is confirmed, the next question is, how will it be treated? Which is what this video is about today. Now, without treatment, some peptic ulcers can heal on their own, but they tend to come back and even have complications. So when you have been diagnosed of peptic ulcer, it is important that you go through a proper treatment, because if you just leave yourself like that, you run the risk of it can heal, but it can come back very often. Therefore, you should seek proper treatment for peptic ulcer. So, how is it treated? There's what you call a proper treatment protocol, which is what this video is all about. Now, that proper treatment protocol, number one in it is, an antibiotic treatment against H. pylori infection, and which should be done for at least 2 weeks. Now, you remember that the commonest cause of peptic ulcer is H. pylori infection. So, and that is why during investigation for peptic ulcer, you were tested for H. pylori infection. So if you are H. pylori positive, the treatment requires a combination of antibiotics that you will take, and you're supposed to take the antibiotics for at least 2 weeks. And that is very, very important, because a lot of people have the habit of taking antibiotics and they take it for a few days and they stop. When you do such a thing, you run the risk of the H. pylori bacteria not being properly eradicated. And when you have that kind of situation, it's going to lead to a resistant form of infection. And once it becomes resistant, it will make the treatment of the peptic ulcer more difficult. So it is important that you take your antibiotics for at least 2 weeks, according to doctor's prescription. Now, the other treatment that is required is treatment that has to do with reducing the impact of acid on the ulcer. Remember, we said that the ulcer is in the stomach, and then where there is a lot of acid secretion, so which promotes the symptoms and makes the wound not to heal properly. So we have acid lowering drugs. A popular one is what you call, the popular group is what you call the PPIs, or proton pump inhibitors. Popular brands include the omeprazole, lansoprazole, the ones a lot of people know about. Then we probably have another set of acid-lowering drugs, which we call the cimetidine, famotidine, those names. So the importance of this drug is to lower the secretion of acid so as to allow the wound, give it space for it to heal properly, heal from inside, and the person will be okay. Now, these acid-lowering drugs have to be taken for at least 8 weeks. It's not something you take for some people may take 1 week or 2 weeks and they feel they have done something. No. You need to take your acid-lowering medications for at least 8 weeks. And then another group of drugs that could be given to you are the ones we call the cytoprotective drugs. These ones actually prevent further damage to the lining of the stomach and intestine. Examples include things like sucralfate or bismuth subsalicylate, the one we popularly call Pepto-Bismol, or equally we can be given misoprostol or cytotec. These are drugs that help to protect the lining and encourage the lining of the intestine to heal, so that the ulcer will be properly taken care of. Now, the next thing is advice on lifestyle modifications, because while you're taking these drugs, your doctor has to place you on advice on some lifestyle issues that will enable you to get the ulcer properly treated. We are going to give time to that on our next video to talk about the lifestyle modifications that can help in the healing of ulcer. Is very important. Now, in some cases, if the ulcer is very severe or it has some complications, maybe it was diagnosed through endoscopy, there may be need for surgical intervention for such ulcers. And so the upper GI endoscopy, even though it's important in the investigation, is also equally important in the treatment of some ulcers. And there are some cases of ulcers that require, the ones that come with severe complications, those ones require open surgery. You're taken to theater, they open up your tummy to take care of the complications. Maybe there's gastric outlet obstruction, or maybe there is perforation, paralytic ileus, or intestinal obstruction, or bleeding ulcers, or something like that. Such ones may require open surgery. So, now, another important issue we talk about, if you've been following carefully, notice I didn't mention antacids. Yes, a lot of people take antacids for ulcer. But the reason I didn't mention antacids are medicines that actually neutralize the acid in your stomach. They're alkaline compounds. They help to neutralize acid, and by doing that, they help to relieve the symptoms rapidly, relieve indigestion, heartburn. And there are so many brands out there like Gelosil, Andrews liver salt, Gaviscon, Gestid. There are so many. But the challenge with antacids is that a lot of people that have peptic ulcer issues, they know about antacids, so they go to the pharmacy or the drugstore, and they just buy antacids and they take without prescription. Now, when you take antacids without prescription, the chances are that it can promote H. pylori infection and worsen peptic ulcer disease. How? Because it is alkaline. The antacids are alkaline. And then the H. pylori infection is also bacteria that thrives in alkaline situation. So each time you take a lot of antacids, especially without prescription, without going through the proper treatment protocol, you could be increasing the alkaline state in your stomach, which will in turn increase, encourage the multiplication of the H. pylori bacteria, and in the process, it can worsen the peptic ulcer disease. So that is a very important point. So rather than you having ulcer and just taking antacid anyhow without proper medication, it is important to go through the normal treatment protocol. Let the antacid be given to you or prescribed by your doctor so that you can take it the way it will be beneficial to you. And of course, they do come with some side effects, which could be either diarrhea or constipation, depending on which the components, the chemicals that it is made of. So after having gone through your treatment, the next question we should ask is, a lot of people want to know, I've taken this treatment, how do I know that my ulcer is healed? One of the things you're going to discover that will let you know that you are receiving healing in the ulcer treatment is that your symptoms will go down. The pain will reduce significantly. Other symptoms of indigestion, the things you used to complain about, they will equally improve. But these are not yet confirmation that the ulcer is healed completely. And at this point, so many people, when they start feeling okay, they start playing with their prescription. You must avoid the temptation of stopping your treatment abruptly without your doctor's advice. Just take your treatment according to prescription, and then you must go back to your doctor for confirmation of healing. And one of the things that will be done in the checkup is to repeat the test for H. pylori infection. One of the signs that things are looking up is that that test will be negative to show that the bacteria has been eradicated. And then in some cases, you may have to go through or repeat the upper GI endoscopy once again. That will enable the doctor to look physically into your intestine or stomach to see that the ulcer has healed. That is a very good confirmation of healing, that the ulcer is responding to your treatment. So that will be all for now. In the next video, we are going to look at lifestyle modifications needed for proper healing of peptic ulcer disease. So if you have received value in this presentation, please, we would like you to comment and then subscribe to the channel, and do not, so you get more of the videos, and then don't forget to share and equally like. So see you in the next video. Thank you for your time.